Hey, back again. Oh, that was a funny noise. Back again. So, what we're going to look at now is some of the things that are out there for people that have a decline in functional needs. One of the strategies that's out there from the government is called Better, Sooner, More Convenient Healthcare in the Community. And it's an initiative that came out quite a few years ago. So it's about better services for the patient through primary, which is community based, and secondary, mostly hospital based, health professionals working together more collaboratively, sharing patient information more readily, and working together with patients to provide effective healthcare. So it's about everybody working together as a team to be able to provide healthcare to the person. And it's not just, well, the person's out in the community, so they only get community care, or the person's in hospital, so they only get hospital care. It's about working together as a team. Sooner, this is quite self explanatory. It's about lesser waiting times for people by providing more services in the community and providing a smoother flow between different parts of health services. So, if the person goes in for one thing and it's discovered they need another, it's about providing a seamless flow through the healthcare system so that they get the care they need and they get it a lot quicker. More convenient. Now, most people live quite close to their GP, but they do not live really close to the nearest public hospital. So, and it's always easier to arrange a time to see your GP than it is for you to arrange a time to see your hospital. You have to go on a waiting list and then you have to have an appointment sent out, and they just take it for granted that you're going to be available on that day and that you'll do everything in your power to come and see them. It's not always the way. Okay. And for some services, especially for people with multi long term illnesses, as we said before, multi-morbidity, assistance in the home or other convenient settings can help to ensure that they remain well in the community, avoiding unnecessary stays in hospital. And this is about hospital staff getting out into the community, still working for the hospital, but getting out into the community and seeing patients at home instead of bringing them into the hospital and then they can't make the appointment and then they get worse and then they get admitted to hospital. So it's about working as a team, both primary and secondary care. The information on that one is the Better, Sooner, More Convenient Services is actually up on Moodle as well. The whole booklet's up there. It's really interesting. Okay, so the ministry's priority outcomes is that the workforce supply meets service demand. I will admit that they're trying their hardest to do this. There just isn't the money there to be able to do it. Systems and services are more patient centered. Um, the hospital system just expects that you'll be able to make an appointment, and when you can't, they try and make you another appointment at another time that's convenient for them. But you can't always make those appointments, so they're trying to make it more patient centered. Faster access to high quality hospital services so that you're only in there for a short amount of time instead of being admitted to hospital for a long amount of time. The leadership and planning are clear, effective, and coordinated with all care. So, the leadership and the planning of the person's care is coordinated with all agencies and it's effective. It's not just there because it's a nice to do. Every dollar is spent in the best way to improve health outcomes. So, you're there to improve the health outcomes, not just to, say that you've done something. More services delivered locally in the community and in primary care. So they're looking at moving services out of the secondary system and into the primary system. I know a good A good way of doing this is, and it's very slowly working, is having health practitioners out there in the community, so that the burden comes off the specialists in the hospital. I know that there's a lot of older adult health nurse practitioners out there that work with the older adults in the community, and this saves a lot on hospital admissions of the older adults. Whānau Ora Maori families are supported to achieve their maximum health and well-being. So it's about a lot of that is about health promotion and making sure that they get the health care that they need because they're not very good at going and seeking their own health care until it's too late. So, what are the main places out there for people to go? Well, one of them is Age Concern. Age Concern is a very well known agency out there for older adults, and they do a lot of health promotion for older adults and education around things that they need to know. They're also very good at looking after elder abuse and neglect, and elder abuse and neglect is huge out there in the community. Um, and it's also been found that a lot of the time it's family members abusing their elders. And it's not just physical abuse, there's all sorts of abuse out there, as you will learn. And with the elderly, it's actually financial abuse. And neglect is huge. They get sat in a corner and not looked after properly. Accredited visiting services. Now, anyone can get involved in accrediting visiting services. You just need to be police vetted and go for interviews. I'm pretty sure that's how it works. And what happens is they go through and they get people to visit the elderly in their homes so that loneliness is no longer a concern, that they know they're going to have someone come and visit them, have a cup of tea with them. They're not there to cook and clean and do all that sort of thing for them. They're just there to visit. There's an age concern shopping service. So this is where age concern will help you with your shopping, will help an elderly person with their shopping so that then their nutritional needs are met. Social connection projects. It's about getting elderly people connected with the community and being able to socialize. Mobility scooter safety awareness. These are actually one of the educational programs where they teach the elderly how to look after their scooters and how to use them safely. There's things like drive life without a car because they lose their licenses, not allowed to drive anymore. So they have education around how to live without your car. And then they do things like cooking. Just cook for healthy aging. So they teach elderly how to cook and what sort of meals are good for them at their age. Balance Aotearoa. Now, this is an overarching agency and it's a charitable trust that makes a difference in the lives who are affected by mental health issues. It's constantly evolving in their understanding of mental health and addiction services. So it's not just for things like bipolar, schizophrenia, depression. It's also about addictions as well. And it's about making sure that people get the support that they need for their physical well-being as well as their mental well-being, and that their recovery is full and complete and they become resilient in their addictions or their mental health issues. Disabled Persons Assembly, again, it's an umbrella agency and it includes all disability groups. They work in collaboration with others to achieve inclusion for all New Zealanders. Okay, and this comes off their website because I couldn't write it any other way. Your impairment could be physical or sensory. You may have a learning disability or experience of mental health, or your disability could be neurological health or age related. They'll still look after you. We project an active, independent voice that reflects your aspirations, your concerns, and your rights. So they're a really, really good advocate for the disabled. They will speak for you. Every disabled person is listened to, as are all organisations within our disability community. So, what they try and do is basically marry you up to the right agency um, for your needs. And they will advocate for people because they are experts at knowing disabled persons' rights. Ka Māori Aotearoa. Now, this is a really interesting one. Have a look at their website, and it's about their support services, and they give information and right and advice to its members as well as disabled persons in the community. So they're an advocacy group again, full of information and advice, and they can pass you on to other people. Disabled Resource Centre, these are the ones that do things like home care, home help, or personal support in your home. So they're the ones that can come into a disabled person's home and look after them and make sure that they're getting everything that they need. They also help with getting people involved in their community, finding work, and learning new skills. So they're really proactive in making sure that disabled people are a part of the community. General health and disability information services, and extensive library. So they have a huge library of health and disability information out there, and they also help you with that sort of thing as well. They've got equipment in store and online sales, and that you can hire it, and they'll give you advice on equipment as well, on how to use it and what sort of equipment would be best. They have specialist field officers, disability coordination specific support. So, disability condition specific support, sorry. So they're able to give support to a multitude of people with different disabilities and different conditions. CCS, Disability Action. Okay, so these are very forward thinking group, and they say that every disabled person is included and participates in the life of their community and their family. And they have a huge amount to say for themselves, really proactive. They are amazing advocates, and they will teach people to be self advocates as well. They've got social systems, they advocate for human rights, the well being of people. Um, and the fact that a disabled person can make a conscious choice about what they do in life. So again, they have a lot of information on how to get people functioning back in the community. IHC. Now, a lot of people think that IHC is just one entity and it's intellectually handicapped in your community. It's actually a group of entities, there's three of them. You've got IDEA Services, and they support adults of all ages with intellectual disabilities to live in their own homes and be part of their local communities. So again, they're advocates for making sure that people with intellectual disabilities that have reduced functioning are able to live in the community. Accessible Properties works alongside them, and they provide social and disability housing and a place for people to belong and thrive. So they make sure that wherever the intellectually disabled person goes, that they feel like they belong there, they feel like it's their home, and they can grow, develop, and they can make a life for themselves. Now, this is in place of what used to be the asylums or the institutes, where, someone with an intellectual disability was institutionalized and just left there. So these are the things that are happening. Choices New Zealand facilitates flexible support relationships and access to community services to help people with all disabilities and health related conditions achieve their goals. So, this is about, again, giving the disabled person a choice and letting them live their life and achieve the goals that they want to achieve. So, last bit on Mrs. Brown. You visit Mrs. Brown 3 days after she has been to the doctor for a checkup, as she has been unwell. She is unhappy and crying when you arrive. You ask her what is wrong, and she tells you that the doctor has found that she has high blood pressure, diabetes, and congestive heart failure. She is worried about how she is going to cope with the diagnosis that she has been given and how she is going to carry on with her day to day life. Working with the policies of your workplace, what agencies could you recommend for Mrs. Brown? Now, you also need to put in there why you would recommend those particular agencies. You can use the agencies that are mentioned here, or you could find some different agencies that you could recommend that she go to. And you need to tell me who you would talk to about getting agencies that you have recommended involved in Mrs. Brown's care. So, again, would you talk to her doctor? Would you talk to her nurse? Would you talk to your supervisor? Would you talk to her family? And you need to tell me why you would talk to those particular people. So it's about where you would set, what agencies you could recommend, why you would recommend those agencies, who you would talk to about it, and why you would talk to those people. So that's it for functional needs. Have fun with Mrs. Brown. And hopefully, we will see you all very, very soon. Ka kite!